Hi, this is Bob Roth, Managing Partner and Co-founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You, here on Money Radio 105.3 FM, 1510 AM, and the World Wide Web. If you're joining us today, it must be Friday, and indeed it is. And here we are to share about how our aging population can live a healthier and happier life. And how we do that is by bringing on expert guests to our show each week. Today is no different. But before I introduce our incredible guest, my name is Lauren Straight, Marketing Director for Cypress Home Care Solutions, filling in today for Managing Partner and show host Bob Roth, which is a very special honor. We are doing this interview over the phone today, both our guest and myself. And so I want to just make sure we have a great time. It's really hard to believe that we are in the month of October already, despite these incredible warm temperatures. And with October comes a very important health awareness month. As many know, October is Breast Cancer Awareness Month, and we thought the best way to celebrate is to bring on a very special guest who I do not believe that we've had on the show yet before to date. Without further ado, please welcome specialty fellowship-trained breast surgical oncologist, Dr. Sommer Gunia, from Honor Health Cancer Care and Comprehensive Breast Center of Arizona. Welcome, Dr. Gunia.
Yeah. Hi, Lauren. Thanks for having me.
Yes, thank you for joining us. Now, Dr. Gunia, before we get started on this very important topic, can you share with our listeners a little bit about yourself and how you got into this profession?
Yeah. So I chose to go into general surgery, and with that, we have to do testing throughout the year. And I really just felt the breast component was very difficult just because there's always research going on, and just the way that we care for patients continually improve. And so it was hard to keep up on that. And so I actually found a surgical oncologist to rotate with for a month, and he specialized in only breast surgery. And I was able to work with him, and not only that, we published a paper together, and I really just fell in love with breast surgery, mainly because I still get to do surgery, which is what I love. I still get to cure patients, which is what I love, but I also get to create a relationship with these patients instead of, as a general surgeon, I felt, as more acute care where you're hospitalized for something, I take care of you, and then I don't really get to have a relationship with you. That's what I really loved about the breast cancer component.
I love that, and thank you so much. You're doing such incredible work. It's just very admirable to listen to professionals who've dedicated their lives to helping people and helping their communities in such a way as you. So we really appreciate what you do for our community, especially here in Arizona. And I know you want to talk a little bit more about all the testing and things that you do, starting with family history and genetics and risk. And I figured we could do a little bit of myth busting. There's so much noise out there, Dr. Gunia, and would love to have you share with us a little bit about what does that mean? What's true and what's false out there, especially with so many new things that have hit the market in just the last couple of years.
Yeah. So one of the things I really wanted to highlight, especially this month, was that, I think people misinterpret that if they have no family history of breast cancer, then they're really not at risk for breast cancer. But that's not true. Definitely, if you have a family history of breast cancer, that does increase your risk. However, there's other environmental factors that even if you don't have a family history, increase your risk of breast cancer. So less than 10%
Can you share
of
a little
breast
bit about
cancers.
that?
Yeah. So less than 10% of breast cancers come down the family line genetically. So meaning if you had a, BRCA1 or BRCA2 mutation, which we can do that in more detail if you want, but most are just environmental because of things we've been exposed to in our life, like food, water, stress, just the environment in general. And so some of the things that we ask when you go get your imaging, or if you were to come have a consultation with me, is we ask things like how old you were when you started your period, because the younger you are when you start that, it increases your risk. If you had kids, how old you were, because if you have kids at the age of 30 or later, or if you don't have children, that increases your risk. If you have dense breast tissue, that increases your risk. If you've had previous breast biopsies, that increases your risk. And if you drink more than 2 alcoholic beverages a day as a woman, that also increases your risk. So there's just different things that we look at just to see what is your risk compared to the general population.
Right. And those are such great things to talk about. I had no idea. I'm sitting here as a 40-year-old thinking about all the things that come your way when it comes to women and women's health. And I didn't think about, how old I had my kids, or, when I started my first period, and that would be a risk factor. Can you talk a little bit more? I know people do want to know more about the family history part, and maybe even some other cancers that might run in families that also may be linked to breast cancer.
Yeah, so the one we most commonly talk about or we hear about on the media is the BRCA1, BRCA2, which is the breast ovarian syndrome. That's that one that Angelina Jolie tested positive for, which with that one, your risk can be anywhere from, 40 to 80 something percent in your lifetime of getting breast cancer, and that's pretty high. The average lady's risk is about, 1 in 8 of us to like 12, 14%, somewhere in there. So it's definitely elevated. But there's definitely other genetic markers that we're looking for now. We're actually testing for over 27 genes now. So this includes like CHEK2,
Wow.
ATM mutation. Yeah, and that's just because we know different cancers can run in different syndromes. And so we're really aware of that today.
Wow, that's incredible. And can you talk a little bit more about, how you guys came to find out that now you're testing all these different genes and what that means for us?
I think it's really come about more just with the knowledge. Just initially,
Sure.
we started doing it just for patients that had a very strong history of breast cancer. So you had to have like 2 or more first-degree relatives before they would test you. But now, American Society of Breast Surgeons has come out saying that any lady diagnosed with breast cancer should get tested, because sometimes we can get sporadic genetic changes. And we've just found that with these other genes, because breast cancer can be linked with that, but it can be, associated with melanoma, pancreatic, prostate, colon cancer. So there's just a big gamut of them. There's so many genes that it even gets confusing for me because it gets updated so often. But they have these very
Right.
big databases that they keep, and they're constantly reevaluating those to let us know if there's something that if you've been tested for before and it was just a variant, letting us know if it actually is a risk for breast cancer or not.
That's really interesting. And so you touched a little bit on getting tested. Do you have any new recommendations on who should be tested, what age that is, and if you've been tested in the last 5 years, should you be tested again?
That's a really good question about timing. So we really don't recommend that anyone get genetically tested until they're an adult, just so that they can make that decision as to know if they want to have that knowledge or not. So,
Okay.
we usually say over the age of 18, because really we don't see cancers younger than that, so it's safe to wait that long. Even with BRCA positive patients, we typically don't start doing any increased screening for them until they get to the age of 25. So people that we consider get testing is, if I see patients in my office and let's just say they have 3 different types of cancer in their family, like a colon cancer, a melanoma, a breast cancer, for me, and especially if it's on the same side of the family, if it's all on mom's side or all on dad's side, that, piques my interest. And so I actually will talk to patients about, do you want to do genetic testing? And the great thing is, too, is that if your insurance company won't pay for it. Now we actually have programs where it only costs $249 out of pocket, so it's not thousands of dollars anymore. So it's really more available for our patients.
Oh, that's great. So people could come and schedule an appointment with you and get a test, and if their insurance didn't cover that, you could, just pay that fee. That's great.
Yes, correct. Yes.
Okay. Well, you hear the music. It looks like we're jumping down on segment 1, and we're going to gear up for segment 2 and pick up a little bit more about family history, and then talk a little bit more about imaging and how that is all evolved over the years. You're listening to Health
Okay,
Futures.
great.
We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Good afternoon. This is Lauren Strait, Marketing Director for Cypress Home Care Solutions, filling in for Managing Partner and show host Bob Roth today. Today we are talking about Breast Cancer Awareness Month, and we have a wonderful person on today, Dr. Sommer Gunia from Honor Health Cancer Care and Comprehensive Breast Center of Arizona. Welcome, Dr. Gunia. We've been on for one segment talking about family history and genetics and risk factors, and I kind of wanted to just wrap that up if there's anything else that you wanted to discuss there, and then I'd love to dive into, when do we start scheduling our imaging and all of that kind of thing.
Just to kind of finish things as far as the high risk goes, just to let you know, Honor Health Cancer Center, along with us, Comprehensive Breast Center of Arizona, offer 2 locations currently for high risk screening, evaluation, and to follow patients. I have a nurse practitioner in my office named Heather that works with me and helps me see those patients. And then also there's Dr. Shelley Nakamura over in the Deer Valley location. So those are great options for anybody listening out there, or even other physicians that if they had patients they wanted to refer out to further discuss possible genetic testing, we can do that.
Awesome. That's great. We love that. And then, as you're aging and as we're talking about breast cancer, there's a lot of misconceptions about when do I even start? What does my insurance cover when I go and get my first mammogram? And what kind of mammogram do I ask for? Or what do I need to have, other types of testing done? Can you talk a little bit about that?
Yeah, that's a great question. I think a lot of patients get very confused about this because you have different recommendations coming from different places. But for the average lady with not a large family history, we recommend getting a baseline mammogram, which is a screening mammogram. And typically throughout this valley, they're all 3D at this point, between the age of 35 and 40. And then at the age of 40, start yearly mammograms. For ladies that have denser breast tissue, so it'll say that on your report. Sometimes it'll say heterogeneously dense or it'll say extremely dense. For those ladies, I would also recommend every year that they have their screening mammogram to also get screening ultrasounds for both breasts as well.
Okay, what does it mean to have dense breast tissue?
So dense breast tissue means essentially a mammogram is an x-ray of your breast. And so the areas that are denser, which is for reference for the population, is kind of like bone. So the denser the breast tissue, the whiter it is on the mammogram, and the harder it is to see things through it. And so what that means is that when you have that denser tissue, you have more of the milk-producing tissue that's in the breast itself, and that's actually where breast cancer starts. And so ladies that have more density to their breast tissue, it just means that they have more of the tissue that's capable of becoming a breast cancer.
Got it. So is it safe to say that you're more likely to have denser breast tissue when you're younger versus as you get older?
Correct. That's a very good comment. Absolutely. Yeah. So as we age, our breast becomes more fatty replaced. And that's kind of like why age and gravity is not nice to us and everything heads south. That's part of the reason too.
Yep.
But I will say also for ladies as well that if you're on hormone replacement therapy, it's very likely that your breast tissue will stay dense. Or if you are not on hormone replacement therapy and then you get on it, they'll be able to see a difference between the density of your breast from year to year.
All right, that makes sense. And so I know at
Yeah.
the break we were also talking about high risk assessments and when do you know when to schedule something like that? Is that something your doctor would tell you in advance, or how do you know if you're high risk, or walk me through that?
Yeah. Yeah. So at most of the imaging facilities now, they'll give you a pad to kind of fill things out, asking you those different questions about when you started your period, if you had kids, how old you were, if you've had biopsies, family history. And the reason they're giving you that questionnaire is because they're trying to figure out what your risk is. And so now at the bottom of the reports, they're putting down there your lifetime risk. And so any lady that has a lifetime risk of 20% or higher is considered high risk, and they should be notified of that. And at 20%, that is when we recommend not only do you get mammogram every year, but that you get MRI, and we alternate that screening every 6 months. And it's not to scare ladies to say they're going to get a breast cancer. We just know that because of that elevated risk, we should watch them closer because we just want to catch things super early if it's going to happen.
Oh, that's really good to know. And so so you should be armed with these questions in hand as a patient, essentially, when you're getting this done, or do you ask these questions at the imaging centers, or do you take them back to somebody like you, or how does that work?
Well, so the imaging center will have you fill out the questionnaire, and I don't know if they would have the answer for you that day while you're there, but it should be on the report. And I think you definitely could be your own advocate, and while you're there, ask them if they've done the risk
Yeah.
assessment and what it says. Yeah,
Okay.
but it should be
Okay.
on the report. And then, so then whoever ordered the imaging for you should know that you're at higher risk and get you into that screening, or they would probably refer you to a breast surgeon clinic or high risk clinic to be followed so we can do the imaging and keep
Oh,
up to
that's
date
good
on
to
that.
know.
Yeah.
That's good to know. And then you also talked about, recommendations and surgical options if you do get imaging done, and there are things that come up on those imaging tests.
Yeah. So, you had asked a question too about imaging and the difference. And so, if on your screening imaging, if they find something that looks abnormal, they'll want you to come back for diagnostic testing. And so,
Oh,
what
yeah.
that means is more of a special mammogram where they actually will compress that area even more, because sometimes on your regular screening imaging, if normal breast tissue is kind of denser and it overlaps each other, it can look like an abnormality. But then when you actually get your diagnostic mammogram and they compress it even more, if it effaces or means it goes away, they can say, all right, that was just dense breast tissue, and typically they would do an ultrasound at that time. So that's the difference between the imaging. So if there's anything in question, so, if ladies are having new symptoms such as nipple discharge, a new lump, breast pain, most likely they should ask their primary care or whoever's ordering the imaging to order diagnostic imaging so that they don't have to go back again.
Oh, that's a good point. So ladies don't necessarily need to be concerned if there is something abnormal. It doesn't necessarily mean cancer. It just means you have to get additional things done to ensure that it's not, correct?
Correct. And most times it is going to be either disappear or it's going to be something very benign appearing. So meaning not cancerous. There's many, many reasons that we can get abnormal imaging. It just happens to be that cancer can be one of them. Yeah.
What are some other questions that patients or women that should be asking themselves or talking with their doctors about, especially as you start going through menopause and hitting that life transition phase? I'd love to just hear from you on, even if people have heard some things before. It's always a good reminder of what's that quick list of things that I should be asking in the midst of all my women's health things I have to keep up on.
Right. Yeah. Well, one I get commonly from patients is them saying, well, I hit the age of 75 and my doctor told me I don't need to have mammograms anymore, which, back in the day, that would have been the answer. However, here in Scottsdale, especially, 90 is the new 80. So, ladies are still have great lifestyles. They're still very healthy, active. So, our new recommendations are, if you've got good 5 years of living, good standard of living, that we say continue to get your mammogram. So there's not an age cutoff anymore.
Oh, that's really great information. Well, as you can hear the music, we are wrapping up segment 2. We have Dr. Sommer Gunia from Honor Health Cancer Center and Comprehensive Breast Center of Arizona on the line. We are down 2 segments with 2 more to go. Please stay tuned, and we'll be right back.
I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you here on Money Radio 105.3 FM, 1510 AM, and the World Wide Web. We are also podcasting right now, so for those of you who like to download podcasts, you can find Health Futures wherever you're podcasting. Download, like, and even recommend our podcast to others. My name is Lauren Straight. I am Marketing Director for Cypress Home Care Solutions, filling in for Managing Partner and show host Bob Roth today, which is a special honor. And I just cannot believe it's October. We are celebrating October and Breast Cancer Awareness Month this month. And we have special guest Dr. Sommer Gunia from Honor Health Cancer Care and Comprehensive Breast Center of Arizona here with us today. Welcome back, Dr. Gunia.
Thank you.
All right. So before we get started, Dr. Gunia, do you want to share how people could get a hold of you or where to go for your website to either call you or your website so that if they wanted to schedule an appointment with you, they could?
Absolutely. You could go to the Honor Health website. All of us are listed there. I have multiple partners throughout the valley. I practice at the Scottsdale location, and I do my surgeries out of the Shea Piper Center and down at the Greenbaum Surgery Center at Osborne. My office number, do you want me to give the office number?
Sure. Yeah, absolutely.
Okay, it's 480-629-8390. Also, a website is azbreastcenter.com.
Awesome. Thank you for that. And we've been having a wonderful discussion about women's health and breast cancer. We've gone over family history, genetics, and risk factors. And then our last segment, we talked a lot about breast imaging and dense breast tissue. And so now I kind of want to segue into, okay, we've talked through all of that. Now, let's get a little deeper into these high-risk scenarios and then what kind of treatment options and new tech is out there. So I'll kind of let you start and share the journey from there.
Yeah, so in the last segment, I briefly touched that ladies that have a 20% risk of breast cancer or higher are considered higher risk. Also, ladies that have a genetic predisposition that, for instance, have BRCA1 or BRCA2. So they have elevated risk. And so they actually have surgical options as well for these patients, especially if they have a very strong family history, where they can undergo risk reduction mastectomies, which does include reconstruction, and insurance does cover this. Majority of ladies choose implant-based reconstruction, which there's saline and silicone. Both are equally as safe as each other. And I know we hear a lot about out there about implant illness, and I will just say I've been doing this for 11 years now, and I've probably only met 2 or 3 patients that have had that, and typically those are patients that have autoimmune disease already, that just have very sensitive bodies and have very big inflammatory responses to things. But I would say the average healthy lady does not have those issues.
That's really interesting to know because, yeah, you do hear a lot about that. And then you do also hear about if they have a BRCA gene, they're automatically going and getting double mastectomies and implants. And, is that something that's really necessary these days? I mean, talk more about that.
Well, for the BRCA gene, I definitely would. If you came to my office, I would encourage you to do mastectomies because that's a really high risk. We're talking anywhere from
Sure.
40 to 80 something percent. That's pretty high. And none of us want to give cancer those good odds. And so, yes, I would recommend risk reduction mastectomies. And I would say more ladies are doing it now because the reconstruction options are so good and the outcomes look so great. So
Yeah.
there's the option now where they can do nipple sparing mastectomies, which means they keep all the skin in the nipple areolar complex, and we usually can hide their incisions underneath where the bra line would be. So it
Okay.
pretty much disappears. Yeah. Now, ladies lose sensation of the nipples, unfortunately, with that surgery. But overall, it looks more like an augmentation than it does a reconstruction. Now, there's
Okay.
other option for reconstruction as well, which I think more and more ladies are starting to choose, which is using your own tissue for the reconstruction. So there's one that's called a deep flap, DIEP, where they actually remove the tissue from your tummy, just like a tummy tuck, except for they use the artery and vein, and then they
Okay.
attach that up into the chest and use the tissue there. And the nice thing about that reconstruction is that using your own body tissue, if you gain or lose weight throughout life, your breast tissue well, the new neo breast will do the same thing. It can gain and lose weight with you. And so for ladies, especially if they're at high risk for, rejecting an implant, this is a really nice option for them.
Oh, that's I never heard of that before. That's really fascinating. And are people
Yeah.
still doing traditional, like, you know, um traditional chemo and things like that for breast cancer, or are people just, taking out all of their breasts? Like, what are we supposed to be doing these days?
Yeah. So, surgically, especially, majority of ladies were catching their breast cancers very early, which means
Okay.
that they could be a great candidate for doing lumpectomy, which is just going in there and taking that little cancer out. And really,
Okay.
essentially, if it's not a very large area, the breast is still contour-wise going to look the same. And so that's what we call breast conservation. That
Okay.
itself is an outpatient surgery. You're in and out the same day. It takes about 45 minutes to an hour or so. And then about 6 months down the road, after surgery and radiation, we would just get a baseline mammogram. And also, ladies have the choice to do mastectomy as well. And I
Okay.
think a common thing that patients ask is, if I just do mastectomy, can I not have to do chemotherapy or any type of systemic therapy? That's a great question. And I wish that
Yeah.
what I did solved that, but it doesn't.
Okay.
So, even if we do a mastectomy and all of your lymph nodes are negative and we got all the cancer, our margins are good, there's still that possibility of what if a cancer cell has gotten somewhere in your bloodstream. And what we don't want it to do is to go someplace like liver, lung, bone, which is where breast cancer likes to go, and to grow
Okay.
there. And so that's why for some patients, chemotherapy is recommended. But I would say majority of patients have estrogen positive breast cancers, and they just go on an estrogen blocking pill for 5 years.
Oh, wow. Okay. No, that's really interesting because I never understood. I have a friend who went through this recently, and they ended up doing a mastectomy, but and reconstruction, but she was still having to do chemo and radiation. But that makes sense because it's like if it does travel, it could potentially become worse, right?
Correct. Yeah.
Okay.
Yeah, because if it ends up growing in liver, lung, bone, then that's when it's actually stage 4. And so at that
Yeah.
point, it's not
Okay.
curable any longer. It's just we tried to put you in a remission, which ladies do very well these days. I mean, they can be in remission
Sure.
for years and years and years and years with all the new therapies. But yeah, that's why we want to
Wow.
catch it early and then do everything we can do to reduce the risk of it coming back.
That's awesome. And with such the technology that's just grown and evolved just in this last few years. I mean, before this, I worked at Honor Health for many, many years, doing marketing and promoting types of things that you're doing, right? And it's just fascinating to learn how fast the technology and the robots and the medicine has evolved. Is there anything new in this space of breast cancer and breast health that is happening, or are we doing anything? Is there any clinical trials? Is there AI that we're using? Talk to me about any new things that are on the market or being tested, or what you know. Well, I'll save that actually because we hear the music. So we'll save that for the last segment. You're listening to Health Futures, Take Stock in You. We have Dr. Sommer Gunia, and we will be back just shortly for the final segment.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Hello, my name is Lauren Straight, Marketing Director for Cypress Home Care Solutions. Today I'm filling in for Manager Partner and show host Bob Roth, which is a special honor. And we have been talking this whole hour about breast health in honor of Breast Cancer Awareness Month with the one and only Dr. Sommer Gunia from Honor Health Cancer Care and Comprehensive Breast Center of Arizona. Hi, Dr. Gunia.
Hi, thank you for having me.
Of course. Well, we are wrapping up with our fourth segment where we kind of teed up the last segment asking questions about the latest tech in the breast cancer world. And so I'm just going to let you hit us off in sharing about what's new, what's going on in that space with all the evolution of technology in medicine.
Yeah, well, this is what is so fascinating about breast cancer is I just love all the new technology that we get and all the new research that comes out. But I'm the new technology representative for our group, and so I'm the one that gets to try out all the new technologies. Yeah, to find out if we think it works, doesn't work. You know, we're always constantly trying to give our patients a better experience, better care, less surgery. So it's really great. So one of the things I'm super excited about that I was part of a trial called Film B, which we did that back in few years ago, but it's actually a way for us to find sentinel lymph nodes in surgery, which is a really important part of breast cancer staging. And sentinel nodes are the first draining lymph nodes that your breast drains through. So lymph nodes are like little water filters. They filter and trap things that are trying to leave the breast. And so we want to look at the first guardian lymph nodes that protect you. And how we find that is now at Honor Health, which is great. Once you're asleep in surgery, we can actually do the technetium injection in surgery after you're asleep. And that's a nuclear medicine that travels to those lymph nodes. It gets trapped in those special ones. And then there's a gamma probe that makes noise over the lymph node that has the highest concentration. This new technology called SPI-FI is where we inject two little green dots of endocyanine green that also travels to those lymph nodes, and then they glow underneath this special camera, kind of like if you watch ocean shows about jellyfish and how they glow. It's very similar to that.
Yes.
And so that's really, really helped. It's very cool. Yeah. And
that is fascinating.
Yeah, it's very cool.
So it lights up kind of where you see more deposits, which in essence could be a cancer.
Well, it's just telling you which lymph nodes are your first draining lymph nodes, because if there's no cancer in those, then there's no reason to think any cancer could get beyond those ones. So we just know that those are the first couple of lymph nodes that we want to look at. Yeah, and so just because they glow doesn't mean there's anything there. It's just showing us where there are. And so I think it's just made the surgery simpler, removing less tissue. Just a lot of good benefits from it. And another great thing, too, is that the same technology, which is using the endocyanine green, is also used for the reconstruction component of the surgery, because we can actually look at blood flow live in surgery, which we call perfusion. And that was really, really helpful because for patients where I do a mastectomy, I'm removing a lot of the blood supply that goes to the skin and the nipple areolar complex. And so this allows the plastic surgeon to actually put in the estimated size of implant in there and look at the blood supply and make sure that everything's going to heal up nicely. And if not, they can always use a smaller implant. or make a different decision. And so the technology is just amazing. And so it's allowed more and more patients to go straight to their permanent implant rather than having to do the expander reconstruction first, which is great.
Right. Well, and then the recovery time is pretty much cut in half, would you say? I mean, especially having you down one whole surgery. That's awesome.
Yeah, well, and the expanders are not super comfortable, and you have to go in for fills every once in a while, and then, yes, that does require another surgery where they have to exchange those. Yeah.
I'm holding
so it's definitely
my own,
much better experience for patients. Yeah.
That's good. Well, and I know that, you know, with all of these, the new tech and everything happening in this space, there's always, you know, we're needing funding and things like that for it. And so it's a great segue into, you guys have an event coming up this weekend, right?
Yes, we have the 5K Pink Out coming up. And this is, we've partnered with Check for a Lump, which is a really great nonprofit group that really has filled in to help take care of patients in need once the Susan G. Komen left Arizona.
That is awesome. So that's happening. It's called Check for a Lump Pink Out 5K. It is on Saturday, October 5th, 2024, starting at 8 a.m. at Steel Indian School Park. It looks like there are free mammograms, there's local vendors, a kid zone, food trucks. And the greatest thing I read about this was 100% of the profits stay local here in Arizona and help sustain our vital breast cancer programs that provide free education, mammograms, testing, wigs, that's huge for women, and support. And you can actually still register for this event at checkforalump.org. So again, that's happening this Saturday. So tomorrow morning, 8 a.m., October 5th at Indian School Park, Steel Indian School Park. So that's really, really great. Are you going to be out there?
I will be there. I'll be at the vendor aisle. And the great thing too is we bring our dogs, so it's super fun. I'll be out there with my 2 long-haired wiener dogs. And they actually, it's super fun. And so a lot of people actually bring their dogs. It's pretty fun. And then because there's a heat warning, they actually have shortened the event, so it's actually not going to be a full 5K, just so everybody knows they're not disappointed when they get there.
Oh, there you go. Well, that's good. That's safety first. Yeah, we weren't expecting such unseasonably warm temperatures for this first week in October, but it's still going to be a great event. Plus, Indian School Park is centrally located, lots of mature trees and shade, so it's going to be a lot of fun out there. So make sure you head out there. Again, if you want to register, it is www.checkforalump.org. Now, Dr. Gunia, this has been such a wonderful show, having you on and letting us know about everything that's happening. Is there anything lasting that is on your mind that we haven't talked about yet that we want to wrap up the show and make sure that our listeners know?
Gosh, that's such a good question because I always have things going through my mind all the time. And of course, now when you ask me, I can't think of like the one like most important things I would say. But I guess, you know, I would put it out there for patients that are taking hormone replacement therapy just make sure you're getting your imaging done, because we know most breast cancers are hormonally fed. And so, you know, if you're on hormones and you have cells that are starting to go down the line of becoming atypical and so forth, it would just actually have more building blocks available for that to happen. So just for ladies to be aware of that and just to make sure they're being very good about getting their imaging every year.
That's really great advice. And, you know, it's just been such a pleasure to have you on the show. And, you know, we've talked through risk factors. We've talked through family history. Make sure, ladies, between 35 and 40, you're getting your first baseline mammogram and then starting your annual mammograms at age 40. And you said don't stop, right? Don't stop after age 75.
Correct.
And then we talked through all the high risk assessments. There's so many new technologies out there. Honor Health also has a research institute where they're constantly partnered with national and international entities for clinical trials and things like that. So be sure you hit up that website and look for things that are happening in that space that may be related to breast cancer. And last but not least, you got to check out this event that's happening this weekend. Check for a Lump Pink Out 5K, which won't be a 5K in this heat. Indian School Park, starting at 8 a.m. tomorrow morning. Go to checkforalung.org. And again, if you want to talk more to Dr. Gunia or to schedule an appointment, you can call her office at 480-629-8390, or you can visit her website at www.azbreastcenter.com, azbreastcenter.com. Dr. Gunia, it has been a pleasure. Thank you so much for joining us today.
Yeah, thank you so much for having me. It was fun. I hope I see everybody tomorrow at the 5 pink out. At the 5K pink out.
Yes, everyone show up, wear your pink, and I hope you guys have a great day, a great weekend, and we will be back next week. Have a great day.
All right. Thank you.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.